Welcome back. The time is now 7:14. We already know about some of the benefits of exercise. It can boost your fitness, trim your waistline, strengthen your heart, even improve your mood. But did you know that exercise can also help to keep your lungs healthy? Dr. Carrere, a Toro internal medicine physician, joins us this morning to explain how exercise is actually linked to lung health. Doctor, good morning and thanks for being with us.
Hi, thank you for having me.
So we just kind of explained to people how this is exercise, of course, good overall for your body, but what specifically about exercise is good for your lung health?
That's a great question. So exercise helps to improve our lungs functional abilities and capacity, and it helps improve our ability to exchange oxygen and carbon dioxide. As you exercise more and more, also you get decreased symptoms of shortness of breath. So if you have underlying lung disease, it helps with your overall symptoms. So you end up feeling much better, and people overall do much better if they are participating in regular exercise.
And then you said once your lungs are healthy, that's great for the rest of your body, right?
Yes, yes. So, our lungs are vital in our heart and pumping and getting oxygen to your muscles. And as you strengthen your heart and your cardiovascular system and thus the lungs, the rest of your body benefits. You can do more physical activity and feel overall better.
Doctor, obviously we're just throwing the word exercise or, movement out to people, but what kinds of exercises are we talking about? Are we talking lifting weights? Are we talking more aerobic or cardio type exercise? A combination of the two? And how often?
Great question. So I would say certainly cardiovascular exercise has been known to help symptoms of shortness of breath and improve our cardiovascular and our pulmonary systems, our lung systems. So that's, the recommendation is 150 minutes a week, which sounds like a whole lot. But if you break it up into small chunks, it's like 30 minutes a day. And what I tell my patients, if they're pretty inactive, is just start with 20 or 30 minutes 3 times a week and start adding to that. I think separately we need to address muscle building as well. So weightlifting, that is really important. I think it's underutilized, talked about. And it really, as we get older, our bone health, especially in women, starts to decrease. And so weightlifting, weight bearing exercises is very important, for our metabolism as well as our bone health and many other things as well.
And doctor, you just mentioned, your patients, when you tell them about this exercise helping their lung health, they might get a little overwhelmed, a little nervous. I guess what question should people be asking if they've never exercised before or they're very inconsistent with it, but they do want to work on strengthening their lungs, they want to work on strengthening their body? What kind of questions should they come to, let's say, a doctor like you? What kind of questions should they come with?
Yeah, that's a great question. So one thing that I think is that, we have programs at different hospitals, such as pulmonary rehab, that is great if you have like an underlying lung condition. So if you need to say like, what with my medical history. So if you have heart disease or lung disease, how can I safely proceed with exercise? One other thing to take into account if you have like a lot of allergies, while we always talk about walking outside, you want to, avoid being outside when I'm looking out the window here, when there's like a lot of pollen in the air, especially in the South or here in New Orleans, or smog and things like that, because that can exacerbate symptoms. So asking based on your medical conditions, how can I safely start an exercise routine would be a good question to ask your doctor.
I think that's an awesome place to end right there. Just
Thank you.
kind of going into your doctor's office with what you specifically deal with health-wise, and ask your doctor to help you start the movement. We don't want to call it exercise, might scare people. The movement process to help the rest of your body be in better shape. Doctor, we appreciate your time so much this morning.
Thank you. Thank you.